beginning first with Evelyn Rogers. I turn it over to you, Natasha. Natasha, you're on mute.
Thank you, Marsha. Good afternoon, Evelyn. Good afternoon, everyone, again. I guess we'll get started with our questions. So my thoughts in regards to elder care, and when I think about the different stages of life and how we have providers that specify in the health of each age range, can you just share a little information on what type of doctors treat elders?
Well, the type of doctors that treat elders is called geriatrician, and he is an expert in the care of taking care of elderly patients, some with multiple health issues, some that take a lot of medications, some that are very frail in health, and some that have had multiple falls and just needs that extra time and extra care. And they are also regular PCP, primary care providers, but they're expert in that field.
Mm-hmm. So when is it time to actually begin to see a geriatric doctor?
Well, when we look at the age of geriatrics, recommendations is usually from age 65 up to 85, but it doesn't depend on the age. It depends on what the needs of the patient are, because sometimes patients, they're happy with their PCP that they have already, their primary care provider, and they're giving good health, and it's up to the doctor and the patient when they decide that they want this.
So what about that patient that is very comfortable with their primary care physician and is not ready to do that switch over to a geriatric specialist? How do we manage that?
Well, like I said, it's up to the patient how comfortable they are with their primary care provider, because primary care providers and patients that have good rapport and relationships, they take care of their patients until, they're no longer here.
Yeah. So it's definitely important for those primary cares that are treating patients that have multiple situations to encourage them to see a geriatric doctor if needed. But for the most part, if they don't have it, it's okay for them to stay with their primary.
Well, even so, it depends on, like I said, it depends on the caretaker and the patient themselves, how comfortable they are. I believe that maybe if it gets where it's too much, the primary care provider would be the one that could help them to find a good geriatrician in their area.
So that's, a smooth transition. So given your experience working in treating the elder population, can you share one or two common health conditions that is associated with the aging?
Yeah, well, two that sticks out. One is hypertension, which is high blood pressure. A person can be treated. Is usually a person that's being treated having an elder, because we're speaking about elders, having a blood pressure of 160 over 100 or greater on a persistent basis. And diabetes, the inability of the body to give enough insulin, or the person not having enough insulin in their body, they would have high levels of blood sugar.
Mm-hmm. So when we think about the different diseases that are common amongst the elders, and at some points in life where some of them are taking multiple medication, it makes me think about the polypharmacy. Can you talk to us a little bit about that?
Polypharmacy, meaning a lot of medications. Sometimes patients, especially the elderly, whenever they visit their family care providers, or if they're in a nursing home, go to the hospital, a lot of times they have a lot of medication. And a lot of medications put elders at risk, especially if they have a lot of, they have comorbidities, meaning other health issues going on. Medications can put them at higher risk. And also, while I'm speaking, I want to highlight the fact that over-the-counter medications and herbal medications are medications also. So sometimes people feel like they're safe because they're herbal or, and they take it with their medications that they're already prescribed, and it puts them at higher risk for falls. It puts them at risk for drug interactions. So we need to be safe.
So what should an elder do that's been given multiple medications? Say almost every time they go to the doctor, they are prescribed something new.
So what happens is, if there's a new medication that is being prescribed, firstly, I would say to the caretakers and to the elder themselves, if they're capable of it, look for symptoms, look and see if there's any changes in the way that they're reacting since they started this medication. Also, speak to your doctor. You're your greatest advocate. If you feel like you have too many medications, ask them, is something that they could tweak? Is there something that they could take away? Maybe I could change my diet. Maybe it's something else that I could do for you to take some of these medications away.
Thank you. That's really helpful. I heard you mention something about the elders and them experiencing falls, which is really common. How do we work together as caregivers with our elders to just avoid falling, reduce falling, the risk?
Yeah, well, you said reduce falling, because falls are sometimes they're inevitable, but the way to try to reduce them is to look at the home environment, look at the lighting in the home, look at like they don't have like those slip rugs, those throw rugs. I'm trying to say, make sure that they have bars, grab bars in the bathroom, raised toilet seats if they need it. Make sure that they have those little sticky things in the bottom of the tub to keep them from slipping. Maybe they could use a shower chair, have a chair in the bathroom where they can sit and get dressed, because a lot of falls happen when patients are getting dressed. Also, like we mentioned, the medications, being very, very careful of those, and just watching out. And also, one more thing is, a lot of time home health is very important in this area, because you can have someone come in and they can assess the house and assess the needs of the patient.
Thank you. That's really helpful. As I think more about the medication and the different adjustments that the elderly go through as they age, I also think about the elders that some tend to be set in their ways, which also invites a common challenge for caregivers in regards to them taking their medication, willingness to go to the doctor, sometimes even getting them to eat or go out and get some fresh air. How can caregivers effectively engage elders in these regimens?
I was thinking of a little scenario while you were talking. So we go to a restaurant and we get inside, and I tell you, sit over here, and I tell the waiter, order steak, potatoes, and yams for them, and order this for me. Now think of it like this. We come into the restaurant and I say, Miss Jones, would you like to sit here or would you like to sit here? Here's the menu. Would you like to pick from the menu, or would you like me to help you? I think involving the senior, the elder in their care is most important. If you look at the first scenario, it's like you're telling people what to do. We forget that even though they're aged, some of them are not capable of making decisions for themselves, but for the most part, they are. Involve them. Ask them what they want. Ask them what they feel comfortable with. If there's something that they don't like, try to meet them halfway and ask them, how can we get you to drink more water? How can we get you to exercise? How can we get you to go outside? So I feel like involving them will get them to be more apt to being involved.
Yeah, definitely. So giving them choices, options, and at the same time, educating them so that if they can make the decision, they have the information. So that's really helpful. So we're all remote right now for the same reason COVID-19 is still present and still just people are still dying, right? One of the things that I think about in regards to elders is the fact that they are at risk. They're at risk simply because of the age. We found that many elders died due to COVID, but then we have some that actually overcame for various reasons. So I guess my question right now is, how can that be explained? Why are, some dying and while others 90 something years old with underlying conditions, they've made it.
So we have to look at it two ways. There's chronological age and there's biological age. We have to look at chronological age as the amount of years that a person's been here on the earth. But biological age, they might be younger. So you might see, like we see on the internet, some 90-year-old that's running races. They're built, their body, they're strong, their muscles are strong. So I look at it as a person that's sickly. They could even be young, that's more sickly, have more comorbidity, have lung issues, have respiratory issues, have diabetes, uncontrolled. They're more apt to, if they get COVID, to succumb to having to be hospitalized, having to be on the ventilator, or even dying, as we spoke about. So it depends on a person's health, and it depends on how well they're addressing their issues, if they have any.
Thank you. Thank you. So the underlying condition is really the primary factor that we all need to be concerned about. Thank you for that. And you mentioned about some of them being able to run marathons. That makes me think about positive aging. Can we talk a little bit about what that is?
Positive aging, it's the way a person looks at, okay, I'm getting older, but embracing getting that way. It's holistic. It's about your health, about your mental status, about your finances, trying to eat well as best as possible, trying to manage things. Like you mentioned, COVID and the way that we socialize now. We're able to still socialize on Zoom, social media. So people need to embrace that and not be by yourself, because when you be by yourself, I'm sure that they'll talk about depression. These things can happen. So just embracing where you're at and embracing yourself, your age.
Awesome. Thank you for that. I really appreciate you taking the time to share with us today. You definitely enlightened me in a number of ways. So thank you. I'll now turn it over to Marsha Williams, who's going to take the interviews further.
Thank you, Evelyn and Natasha. Those were some excellent questions. The next panel member is John. John, I'd like to ask you, can you share an overview of what an effective caregiving plan includes?
Certainly, Marsha. Prefacing that, though, with the plan I would speak to is a plan when we're dealing with someone that we love and we have the time to get them involved or look towards addressing a plan with them, rather than something that hits us out of the blue, like a stroke when we're scrambling around like chickens trying to come up with the right way to do it. But, and again, so many things that Evelyn had said, we look at the most effective family caregiving plans. They're made with the person you are caring for at the center of the conversation. You have to engage that person in. You cannot decide to come at that person and say, Mom, here's a plan. This is what we're going to do. As the same as Evelyn says, we're not going to order a steak and potatoes for her. You're going to do it. This type of plan doesn't have to be extensive. It doesn't have to be fancy. You don't have to, you can never anticipate every particular scenario as you're going at it. the plan should include, immediate as well as future needs. We need to look at the finances. We need to look at what's going to happen with the person. Options, will depend, as I said, on finances, willingness. You've got to put a support team together, and the availability of community resources. That is something we need to look at length. Now, if we were going to create a plan from scratch, I might suggest, we look at a number of steps. First of all, most importantly, as we said, starting the conversation. You cannot begin to engage anyone that you're going to decide to care for them without getting them and getting the conversation going. Next, you want to form your team. You want to look for family members or whomever to on your team and look at the ways that different people can use their particular skills. Not everybody has to do the same thing, not every family member or every friend, whoever's going to be involved in the team. You're going to make a plan. Kind of put it down on paper. AARP has a very good resource that is the subject of a whole workshop in and of itself, was creating, prepare to care. And that plan has checklists going down as minuscule as medications, list of medications, list the doctors, list the phone numbers of the doctors, list the resources, the bank accounts and whatever. So you want to get all of that kind of stuff together. And most importantly, if you're a caregiver and you're going to do that, you got to find care for yourself. You have to care for yourself. We look at statistics. I think, that almost 49% of the last thing I looked at of caregiving in the home is done by a family member, our members. And obviously, if you're going to be the primary support or the only caregiver around, you're going to wear down pretty quickly. Just to share with you, I'm one of those old codgers, 81, who might be in need of care sometime, but I've been a caregiver for my wife for 16 years. And I know that if I didn't get involved in other things or other ways or have some people to be able to come in and assist her, I would not be able to be on the screen with you today. So caring for yourself is extremely important. Also, if you put together a written summary of the plan, you can reinforce, the wishes and the needs of the person who you're going to be caring for. Set up a system to communicate with the team. If you've got different people, what are we going to do? We're going to talk every couple of days, or, we know what's going on with mom or dad or sis. Also, be open to modifications to the situation and team members. Things are going to change. You start a plan today, and as we know, tomorrow something's going to change, and that plan, large portions of that plan may go out the window. So I think that's the synopsis of where you go. Each and one of these things could be a workshop unto itself.
Thank you, John. So the main takeaway is to always involve your loved ones that you're going to be taking care of. Ensure that you have a checklist of things that you go over both financially and medically. And also as a caregiver, it's very important that you think of how do you take care of yourself as well. So thank you. The next question, as you mentioned, caregivers can get burnt out. What are some of the tips that can you give to caregivers for them to effectively manage self-care while being a caregiver to their loved ones?
Okay, I think the most important one is to kind of treat it as an off-the-cuff kind of conversation. You might find it helpful, if you're sitting with mom or dad or sis or whomever, says, something I read an article the other day, about this long-term care situation. We might, how do you feel about talking about it, looking at it? And importantly, try not to anticipate what your loved one is going to say. Let them do the same, or how they will react. Don't just get the conversation going. Getting them engaged in a conversation about what is going on down the road might be easier than you think, but there is resistance, obviously. If someone came to me at this situation, I'm a big shot and said, Pop, we want to get your finances in order. I'd say, bug off, guys. I don't need that. But, you work at it and you go into it. Express your love for them. Know everything that you're going to be talking about is because you want, I'm concerned, and most importantly, keep your ears open. Listen. Anything that they say, you might be, that's the thing that gets you the in. And you're knowing that this is going to take place over time. It's not going to be today. We're going to start talking about it, and we're going to get it going, and we'll have all portions. We'll have complete agreement. It may take a week. It may take months. But once you get started and you get moving with it, you also might consider getting involving other people, clergy. If you know a social worker around, sitting around with a cup of tea, or even a trusted friend to help to facilitate the conversation, get them talking. The most important, I think, with that and engaging them is to get them talking about it themselves. And I think you will find that their concerns are just as much as yours. They just don't want to right away address it or look at it or admit it. You also have to keep in the back of your mind that you're going to respect the wishes of this person, your loved one. Where do they want to live? They want to stay at home. I think you'll find that almost all want to stay at home. Not too many want to rush off to to a long-term care facility or even assisted care facility. How do they want to handle the finances? Do they want to be the one involved every time, or they want to say, okay, let's get a power of attorney going and you take care of my finances. I can't worry about paying these bills anymore. And, you need to evaluate what you hear and understanding their priorities first, and before you take the next steps. It'll move us along to getting beyond that and getting them engaged in that conversation.
Thank you, John. One last question for you before we wrap up. Do you have any tips on what caregivers can do when they're experiencing health insurance for their loved one, handling the health insurance component?
Say that again. I'm sorry.
Regarding health insurance, sometimes it's difficult to navigate the health insurance realm for caregivers, making sure they get the appropriate care and dealing with the medical bills and expenses. So any tips on how to avoid or make sure that you go smoothly through the health insurance process?
Yeah, this is one that I deal with very, very much in that ICAP program in counseling. It comes up almost every single session, every person that we do one-on-one counseling with, and the misunderstanding or lack of understanding about what health insurance, the most common is identifying the type of insurance covering the family member. It's important to know there's a difference between Medicare, Medicare Advantage plans, Medicare Part D prescription plans for drug coverage, Medicaid, and employer or union retiree plans. Most often, if someone is fortunate enough to be retired and have some form of retiree coverage, whether it's from the city or the state or a union or teachers or whatever, these plans take on a life of their own. The union plan might offer some asides, might offer a little bit dental, a little bit of this, a little bit of that. City retirees can carry forward some form of their prior coverage, albeit now secondary to Medicare. So you've got to get that handle on the actual kind of coverage. And also knowing, dealing with mom and pop, it's important to note whether or not if mom is retiring on or relying on pop's coverage through a retiree plan, secondary to Medicare, what happens if he passes? You have to know, does that coverage end? Does it take 6 months, 3 years, whatever it is that for that coverage, will mom continue to have it? Because you're going to be making a plan for her after, if he decides to go right now. So you start off, you get all the insurance cards in one place, you talk to the insurers ahead of time, or the department. If you're the city, you call the HR department at the city. If there's a union plan, you call them and you start talking about it. If you need to understand more about Medicare and what Medicare does and what Medicaid does or does not cover, there are numbers to call to get that information. And again, I referenced the HICAP program, this health insurance information counseling and assisting program through the New York City Department for the Aging. People can call 311, ask to speak to a counselor. We're doing remote counseling now, so that we call the person back. And again, also speaking to a representative of that person. We talk to sons and daughters and sisters, of the beneficiary, and they're calling to find out the answers of how they're covered. So that basically gives you that in a nutshell.
Thank you, John, so much for those valuable resources and suggestions. And I'll turn it over to Natasha for the next panel member.
Thank you, Marsha. Thank you, John. At this time, I will be interviewing Wen Ling. Good afternoon to you again. So my first question for you is thinking about the elderly and the common disorders associated with that population. We find that most experience Alzheimer's or dementia. Can you talk a little bit about what each of them are?
Sure. This is a really good question. I will probably just define the terms first, and I'm going to give you more in details. So dementia actually is a general term for a collection of symptoms that are severe enough to interfere with daily life. So what is the Alzheimer's? Alzheimer's is the most common cause of dementia. And Alzheimer's is not a normal part of, aging. It's a progressive and very slowly brain disease. So what do we know? A lot of people will ask me, like, I can't really, tell the differences. So I will give you an example. If, let's say in this room, we have 100 people, all with a dementia. So what is a dementia? You may see somebody go out in the hot 100-degree temperature, wear the really heavy coat, winter coat. Maybe somebody has a behavior, used to be very soft-spoken, now is totally changed. Maybe wandering on this, neighborhood, even though this person lived in this household for 20 years and unfortunately unable to find home. Those are under the, dementia symptoms, will affect the person's behavior, languages, mind, thought, or decision making, or sometimes will, affect emotional. So dementia actually is a symptoms, it's not a disease. So let's say come back to this 100 people in the room, all with the dementia symptoms. Most likely 60 to 80% of the people, 60 to 80 people, okay, in this room, most likely will develop diagnosis as Alzheimer's, which is a very high percentage. But we also want to focus 20 to 40% of people in this room, because they have a dementia too, but they are not developed as a result of the Alzheimer's. So they could be, for example, people has a stroke, they have a dementia. For example, people may use certain new medication, may have a side effect. People may have damaged a certain part of the brain, they have a dementia. The last part is really very important, is a reversible disease. So for example, somebody using the alcohol for 30 or 40 years, this particular person may experience a dementia too, or maybe certain deficiency, vitamin deficiencies. So there's a lot of other reasons, and we will talk more, Natasha, because this is so important to know. How do we know is my loved one diagnosis as Alzheimer's? So we will talk more about that, but give you a very clear picture is dementia is the symptoms. You come with a lot of different symptoms and really will impact to your daily life. Alzheimer's is a disease, is a really brain cell nerve damage, progressive disease.
So
I hope that answered to your question.
Most certainly it did. So is it safe to say that dementia symptoms are prevalent at the onset of Alzheimer's?
Mm-hmm.
Okay, thank you. So understanding the changes that those who experience dementia go through, my thoughts in regards to the caregivers, how do we support them with caring for their loved ones going through that experience?
Yeah, it's I think John and Evelyn's already talked about a lot of great tips. I'm really just want to focus how to take care of your loved one, unfortunately with a dementia or Alzheimer's, situation.
Mm-hmm.
So number one, I really want to suggest, try to focus sense of her or himself. So sense of the person's self is really important, because you want to respect the person and try to being there, for your loved one. So give you an example, like they used to be a teachers, they used to be a lawyers, they have done a lot of great things in your life. And we often see this as a children would say, my mom used to be so authority in charge of everything in the household. Now I have to show my mom how to brush her teeth. So this is something, you don't want to lose that sense of your loved one. Try to give them some kind of, help, but also respect them. If just come as a breakfast choice, as a dementia, Alzheimer's, your loved one, I wouldn't suggest you give them a lot of different choices. You could say, hey, would you like to have, even omelette or cereal? Only two. And then if the person's still thinking, pause, take your time, be patient, and then say, how about if I help you to choose this? Omelette looks pretty good today. So this is like open and end questions to help your loved one. Another one is living in, your loved one's realities. So very often we heard somebody will say, I want to go home. And this person is already in her home. So you want to live in her realities, because I encounter a lot of caregivers. They're wonderful caregivers, but they will try to convince their loved one, like, for example, grandmom say, this is not my home. And then the daughter will say, what do you mean? You live here for 30 years. This is your home. So in that case, you don't live in her realities. You have to understand why she's thinking about that. So in my agency, we have a lot of great education programs to teach the family members how to facing this situation. For example, somebody will say, I'm going out to wait for my husband, and husband has already passed away 5 years ago. How do you explain it to this person? Either truth or not truth, all not in a good position to really, take care. But we really want you to not to focus the sentence your loved one talk about. For example, I want to go home. You can say, you're safe here. This is, this is pretty good answer, but you could also distract. Why don't we take a walk? And then we come back and then we can talk about more about this. You don't have to mention about, dad is already passed away 5 years ago. You could say, hey, I'm really thinking about that too. Why don't we take a look at the photos you and dad experience, a lot of travel to different countries. Let's take a look at that. So this is called, living in somebody's realities. In that case, the person will feel much more a better like a situation to carry on. Because if you tell the person your husband's already passed away, what do you think? This person is going to say, gee, my husband passed away. I didn't even know that. How terrible is that? So that will affect and trigger certain behaviors. After that day, you may have very difficulty to take care of your loved one. Live in the moment. That's also very important. You can listen to the music, art, doing the art together. That's a really crucial, valuable moment. I think also unconditioned care, I know it's very difficult, but sometimes you just have to move to the next step. A lot of questions you may not be able to answer. For example, if the person look at you, say, you're not my daughter. And that happens a lot. A lot of people call me and then, have a consultation. The person feel very hurt, but you have to remove that hurting feelings. You have to take good care of your loved one. That's more important. I think I want to give you one example. I went to this high school to do the presentation. That was before pandemic. One girl came over to my table before my presentation. She said, I know this disease. My grandmom has this disease. But I want to ask you one question. Why my grandmom only remember my brother's name? She never can remember my name. So I asked her to listen to my presentation. And then after I finished, I said, come back to talk to me. We can talk more. When she came back to my table, I didn't even have needed to talk to her more. She gave me the hug and then she said, I'm going home to hug my grandma. Apparently, I think grandma lived together in the same household. She said, I'm going to give my grandma a big hug. And I don't care my grandma remembers my name or not. So this is so powerful, Natasha. I think that's something we all want to be here together to understand our loved ones' thinking. Sometimes maybe a little bit difficulty because they will have certain behavior you don't want to see because of the brain self damage there. They might ask you, a lot of similar questions again and again. So I think this is a very good question. Yeah, Natasha.
Thank you. Yeah, and I definitely believe that as people age, that we need to really reconsider our expectations of them once they what they once could do, they are no longer able to. At some point, there's a saying, once a man, twice a child.
Yes.
They kind of do revert back and they need the support of the ones that they once supported.
That is so
one of the things that continues to come up with the caregivers that I support is their loved ones not wanting to go to the doctor, it being a challenge with them going to the doctor. And the question they pose to me is, there's no cure for this. So why do I have to go through the stress of getting them to the doctor if they don't have a cure for this? How do we support them in understanding the need to continue with care, medical care?
Yeah, this is a very good question. And I want to honor Natasha. This is a really great panels. And in the beginning, I really just, okay, I'm just going there and then talk whatever. But Natasha is really like the whole team really focused about what the question is can really help our audience today. So this is a great question. There's no medication. Why do I have to see doctor? Okay, so I would advise the people to visit and consulting with their physician care team regularly. But that's not going to be happen because you advise them, but they're not going to do it. Why? We have to find out why. Because some caregivers or maybe patients even feel hopeless. or afraid to use a medication, or afraid to know more about the diagnosis, and next unsure future is gonna be scaring them. So they may decide not to visit the doctors. And I think we heard about Evelyn, how important of visiting doctors. Without the guidance from the medical teams and sometimes the medication is very important to control, the person can enable for them to really go through everyday's life. For example, we might have some people say, my wife used to be very soft-spoken, but now is really into like a harsh and then always, had a bad temper. Sometimes if you use a medication, that can control, if the person forget things all the time, using a medication can help them to remember a little bit better too. So another suggestion is don't just tell your loved one, say you're sick, you have Alzheimer's, you have a dementia symptoms, let's go see a doctor. Most likely the patient will say, no, I'm not going, I'm fine, especially in the earliest stage. So how do we help the family members? So this is my suggestion, everybody needs to see a doctor every year. Okay, so you can convince your loved ones, say, hey, health insurance is paid for in this. And now during the pandemic, you don't even have to visit the office. You can even do the telehealth. I'm pretty sure we have more next speakers will talk about more about that, which is, you're not gonna skip this visit because it's very important. That's something I will advise, especially early detection and diagnosis, and put a whole care management for people with dementia can really reduce the healthcare cost. Because right now, if you just really don't use anything, coming to the middle stage, late stage, it's gonna be a heavy burdens, not only just for the caregivers and family members, also the healthcare, the whole systems. So when you don't take the medication, it's gonna be impact to your loved one, how to take care of you. Sometimes they have to call 911 because they couldn't control the situation.
Mhm.
So, even though, Natasha, I'm gonna mention also, there's no medication to treat and cure this disease, but we have a lot of hopes for the future. We have a whole team of the health, researchers teams to do a lot of, try to find out if there's any new medication to cure this disease, or even the new way to help the person with a, earlier or middle stage patient. So this is a very important and a very good question. Yep.
Thank you. When I think more around the frustrations that are presented to me from caregivers, one of the things I try to encourage them is to maintain their life jacket and making sure that they're okay. So what advice, what information can you share with caregivers in regards to maintaining self-care while caring for the elderly?
Yeah, I think self-care is already heavily talked about this from our two speakers. I don't want to go over, but I do want to know, if you take care of yourself, you can take care better for your loved one with a dementia and Alzheimer's situation. So I want to give you an example. If you're taking the airplane and then somehow, unfortunately, all the oxygen mask came down. And I often ask my student when I do the presentation, I say, okay, this is a very important case. On the right is your 92 years old mom. On the left is your 5 years old boy. Who do you think you should put on the oxygen mask first?
Mm-hmm.
Okay, this is a crucial. Everybody think about it. Who do you think is most important in your life? I got all the answer. 90% would say my mom, she's 92. My son, is still very little. But those are not the right answer. The most important part is yourself. You have to put on the oxygen mask. Then you can help your mom, or then you can help your, son. So this is very important, sometimes overlooked from our caregivers. Self-care is very important. You need to do certain things able for you to push yourself to provide a better care. I have another one case for you, two people, mother and daughter. and then I have done the consultation. Most likely it's really hard for me because I'm trying to help them so much. They have a lot of questions. This was really easy for me. She just want to share with me, through the Zoom meeting. She saying, I have to tell you one thing. And she doesn't feel guilty about it, because we all know caregivers sometimes feel very guilty if you went out to watch a movie, left your loved one at home, or you went out to do the Zoom, the Zumba exercise. You feel like, oh, I don't know what happened to my, loved one at home. She said every morning she wakes up in the morning, the first thing she has to do is meditate. She meditated for 10 to 15 minutes. And then she said, I feel very good about it. Then I will go on through the whole day. She's 24 hours, 7 days taking care of her mom with almost 8 years of the Alzheimer's. So this is something we want to see somebody as a caregivers can really pay attention to your own self-care. She told me sometimes it's really funny. Her mom will stand next to her to do the meditation together. So I thought that's just lovely story. So I want everybody to really think about caregivers is really the toughest job, but you also have to take care of yourself first. Okay.
Thank you. So in order to take care of anyone, you have to likewise be okay within yourself. We are a little bit over our time, but I would be remiss if we didn't talk a bit about elder abuse, which is a very important factor in elder care. So I know that your organization did have a part in addressing some factors. So are you able to share just a little bit?
Yeah. Natalia, Natasha, I want to just tell everybody, this is my last 2 seconds of the question. And I want to say, this team is so thrilled. They really care about your questions. It didn't come up with this question, but I'm going to give you use the 2 minutes to explain it to you. This is a very important topic to take care of your loved one. Sometimes, unfortunately, people would take advantage of the person who has a dementia or Alzheimer's, because they can't really think clear. They can't really watch you, what are you doing. People will write the checks to herself or himself, and without the person without knowing anything. So this elder abuse is very common. So 3 years ago, my team also have a very heavy advocacy team. They mainly reach out to the government's legislators to really push certain things to help and protect the caregivers and the person with a dementia and Alzheimer's. So this elder abuse law actually passed last year. And then it will trickle down from Department of the Justice. So right now, still everything is very new, but eventually this law will really push all the senior centers, hospital systems, and also any agency care for seniors have to have a knowledge about this. They're gonna go through the training. They're gonna create a lot of materials in the different languages. So make sure there's no seniors out there because of this kind of abuse, and nobody can notice them. So I want to probably I will share this through the link, because Natasha just mentioned this, so I really quickly pulled up this. So type of the abuses including physical, not just only physical. We have emotional, we have a neglect, like you didn't provide food. We have a financial abuse, sexual abuse. There's a lot of self-neglect is also one of the abuse there. And this link is shared with a lot of signs of abuse. So for example, you could really pay attention about the bruises. This is something sometimes you don't see, but while you love on changing the clothing, if you visit, you try to look at it to make sure your loved one is okay, but very often, sometimes they may fall too. So this is something like, you really have to do a thoroughly evaluation before you can reach out, say, hey, somebody abused my, grandma. So this is something I really think is a very important topic. And Natasha, maybe in the future, we can really come back to have this we can invite certain authority to come to talk about this. This is such a great question, but it's so important.
Thank you. And I appreciate you stepping in to share how your organization has helped to move that, work forward. I also just want to take a moment to mention that if you suspect or you have any concerns around someone experienced elder abuse, there is a number 1-800-ELDER-HELP that you can reach out to. It's not that you are, you don't have to have anything concrete, but just a concern that you would like someone to look into. There's also what we have called the Eldercare Locator. And that would, if you call the number 1-800-677-1116, they will be able to connect you to local support in regards to elder abuse.
Right. And I also put it in the chat box. So I don't know if somebody joined the Facebook, they can see, but you can definitely share with everybody. You can reach out to our agency, 800-272-3900. You can reach out to AARP. There's a lot of agencies out there can help. Okay. Thank you. Great question.
Thank you again. At this time, I'll turn it back to Marsha.
Thank you, Juan and Natasha. Now we'll have the pleasure of speaking with Yvonne. Thank you, Yvonne, for joining us. We'll be shifting gears a little bit slightly to ask you around mental health disorders among seniors. So my first question to you, Yvonne, can you please share with me or with us, the members on this call, what are the risk factors for mental health disorders in seniors/the elderly?
Sure. When you're engaging in a therapeutic relationship with a senior, you definitely have to remember that most of the causes of memory loss are not because of the natural aging process. They're due to either comorbidities and things of that nature. Depression is a major mental health issue for the elderly. For obvious reasons. Sometimes it's a loss of autonomy, a loss of their physical space, the constant loss of friends and family members. I've worked with seniors that have lost their children. So it is, and they're still alive. So there's some guilt around that. So I would say depression is definitely a major part of that. Anxiety is a part of that. Dealing with their everyday life, not being able to deal with their failing health. That's also a trigger for psychotherapy. But yeah, the major one would be depression. And then of course we talked about dementia and Alzheimer's, but and that is very prevalent as well. So when working with the elderly, you have to remember that you have to consider space and time when working with them. You have to consider not only the mental health issue, but also you have to consider, what they're struggling in day-to-day life, where they live. That also contributes. But I would say like the major mental health disorder for any elderly person is depression. Anxiety, the umbrella of dementia, which causes, my panelists already spoke to, vascular dementia. I mean, it could be a fall that they had that's causing, a lot of geriatrics also suffer from, schizophrenia. So that's also another common mental health disorder. Mm-hmm.
Thank you, Yvonne. So
You're welcome.
Mental health disorders, are there certain signs and symptoms that the caregiver should be aware of or should be looking out for with their loved ones?
Yeah, they're usually the same sort of indicators that will point out to, not so much that it's mental health, but that something is going on. So you may have somebody who stops taking care of themselves. So they're not bathing. That is a very good indicator that somebody who's elderly is struggling. Self-care, medicine management, people that, can't remember to take their medication. But I think if you're looking at a visual component is definitely somebody who's not taking care of themselves physically. They stop bathing. They stop going to social gatherings. If you have someone who's going to a senior citizen center every single day and they show up and they don't show up nine out of 10 times, the other senior's like, oh, somebody has to call Miss Kathy because she's not here today. So don't ignore that. If a senior is coming to the senior center and they all of a sudden they stop going, somebody should be making a call. Doctor's appointments. If someone is regularly going to the doctor and all of a sudden they stop coming or they're missing appointments. So missed appointments definitely should be followed up with a phone call. So I would say those are the key things to look out for. They stop enjoying their favorite thing, right? My mom is 80 years old and since before COVID, she was a bingo person. But trust me, if my mother calls me and says, oh, I'm not going to bingo today, I'm over in her house finding out what's going on. So those subtle things, they're not going to tell you, I'm not feeling well. I feel I'm going through these changes. They're just going to stop doing their regular routine, walking their dog, taking a walk in the park. They may not want to do that anymore. One, because, incontinence. They were able to go to the bathroom and now they're not making it. That could be an indication of something going on psychosomatically that they're not aware of. So there are several cues. It's very easy to find out something is happening with an elderly person.
So thank you, Yvonne. So it's key to pay close attention to behavioral cues and engagement in the community and amongst family members. So thank you for that. One of the things that I wanted to ask you are what are some of the common comorbidities that affect the elderly population that we as caregivers and loved one may not be aware of?
I mean, there's several. So, unfortunately, when you get older, things happen. Hypertension is one, especially in Black and brown people. Hypertension, diabetes, right? That's a comorbidity. So you may be struggling with mental health, you may have diabetes, you might have hypertension. So I would say amongst communities of color, those, hypertension, diabetes is usually uncontrolled. So I would say those are the major two that would cause that. We have falls. I mean, it's not a comorbidity like we know it, but if you fall as a senior, 9 out of 10 times, you're not going to be the same, when you recover, right? So if you need to have a hip surgery, knee surgery, those are not comorbidities as we know them, but those are life-altering changes that do affect seniors in our community. Medicine management of all of that stuff as well is very important. So if you're working with a senior, you should definitely ask them how, who helps them with their medical, their medicine management, their who reminds them. I think it's very important that when you work with a senior and they have different comorbidities, that that you do ask. How do, is someone pre-pouring your medication, right? Is an RN visit is just something as simple as having a nurse go in once a week just to pre-pour medications. I think would help with controlling those comorbidities. And the regular age and, wear and tear of aging, unfortunately, not being able to move around, not being able to climb in and out of your tub. Although those are not medical comorbidities, those are life-altering changes that there has to be some kind of adapting. And sometimes we have to help these seniors adapt to those changes.
Thanks, Yvonne. So it's key to make sure that we're aware of their medication, other risk factors such as hypertension, diabetes, as well as normal changes in your body. The things that you can't do before that may affect mobility limitations. So one question I have for you, and it relates to, the treatment, care strategies that we have to think about, mental health on top of these hypertension, and, what are the appropriate community interventions. Certain elderly behavioral problems may be a sign of mental health disorder. Seniors are more likely to report physical symptoms as opposed to psychiatric complaints. How do we go about assessing mental health in seniors?
Yeah, so one of the joyous points of my career was when I was doing psychotherapy with a geriatric population. So first of all, as a therapist, or a counselor or a social worker or a psychologist, a psychiatrist, I think that we will all agree you have to get rid of the expert role. You can't come in there as I'm going to help you and you're going to be fine. As soon as I talk to you, everything's going to be great. So you got to really come in there and get rid of the expert role. You have to approach the senior, where they're at, treat that person as an expert as well, because they have a lot of experience in something, right? And you have to definitely stay outside the expert role. You have to find what this person loves and start talking about that. Avoid giving advice. So I used to work with a senior, and he used to be like, you could be my great granddaughter, and he was always talking about, how young I was and how can I help him? But I wasn't, I didn't assume the expert role. And I would ask questions. So motivational interviewing questions help a lot too. Where you are in life, tell me about your story, what do you love to do? And then add or guide them in that focus or topic so they can feel engaged, right? The last thing you want to do is take the reins and just ask the regular biopsychosocial questions. You want to definitely come from a partnership, right? Then you want to also accept how they're feeling without judgment. Don't go in saying, you shouldn't do that. You shouldn't yell when you scream. You should say, well, why are you yelling? I had a patient that I got called in for a consult. Oh, Mr. So-and-so is yelling all the time. Well, you know what? Mr. So-and-so needed a hearing aid. It was as simple as that. So because he couldn't hear, right? The audio, and he would yell, but it wasn't because he was being rude. He couldn't hear. So it could be, and of course that was a simpler example that I can share. But partnership, acceptance, and have compassion. You want to be empathetic, but you do not want to be sympathetic, right? You want to say, wow, that must be terrible. That must be really hard, as opposed to saying, oh, I know how you feel, right? So you want to be empathetic, not sympathetic, right? And again, building trust. You can't expect to have dynamicy in your first meeting. It takes several meetings through your psychotherapy section and through your journey to change behavior. And so again, most of the behavior is usually caused by something else. So what does the senior need, right? And then talking about how it can be, how you can change behavior, and that it's not too late. A lot of seniors you hear say, well, I'm already set in my ways and things like that. So I think you have to have a genuine focus on knowing the person that you're giving the therapy to, or trying to form a therapeutic relationship and a treatment plan in. You come in very humble, you work on acceptance, you work on partnership, you have compassion, and you find something that they love to talk about, and you start from that point.
Thank you, Yvonne. That's a nice closing, compassion and having trust. And I want to thank you very much for speaking with us today. In the interest of time, I'm going to turn it back over to Natasha, but thank you very much.
Thank you so much. Those were great questions.
Thanks. Natasha, you're on mute.
That's a habit. I'm sorry. Okay, I was saying, I'll just take a few minutes to share some experiences that I've had with supporting caregivers. While I am a therapist, I'm also a coach, which does allow me to give advice. And I found that in those spaces, some folks need therapy while others need coaching. So with that said, I just want to share some experiences that I've had with caregivers in regards to, we do have elders that have a multitude of individuals that are available to support them, offering ongoing support. Then we have those that really have maybe one person that can offer support and does everything. What I found in working with the individuals that solely support their elders, they are so accustomed to doing the work and often assume that no one wants to help. So one of the conversations that I have involves, do you ask for help, or are you still assuming that no one can help? When was the last time you asked for help? And when you ask for help, do you plan the conversation? I can give an example where I particularly have family members that may not engage in the physical, as far as say giving someone a bath, but they'll go out and they'll shop, they'll do other things. So they engage in support, but they engage where they're comfortable. So one of the things that I want to encourage folks to do is don't stop asking for help. Always let individuals that you trust know that you are in need of help, because some people assume that you have everything under control. When you have those conversations, have a list of all the things that you do for the individual to provide support. Make it clear the type of support that you're looking for to relieve you, but at the same time, be open to allowing other people to do things that you prefer to do. Because in doing that, you still have a lighter weight and you can focus on something else. So it's a lot of times it's about relinquishing that responsibility that we're so accustomed to manage it. And lastly, I just want to say for those that really find that they don't have support, there is the rest care that's out there, and we're going to provide information at the end to those who have registered in ways to contact those local organizations. Back to you, Marsha.
Thank you. Before we wrap up, we'd like to get some final thoughts from our panel members. So we'll start with John for you to share your final thoughts, followed by Juan, followed by Yvonne, and then followed by Evelyn. So John, if you could unmute your line and present your final thoughts. Thanks.
Thank you, Marcia. It's really been an eye-opening conference for me as well. And I appreciate all of the things given by the other speakers. I think my final thoughts were kind of like Marcia, Natasha just referenced. People have to help, those caregivers themselves have to be looking for assistance and support. Again, speaking as someone who's cared for 16 years and was reticent to look for help, just with all the same things that everyone has addressed. I've been used to doing things for the family for all my life, but feeling kind of maybe guilty about reaching out to my daughters-in-law. I have 4 sons. If I didn't have a daughter that would step up and be hollering at me, but thinking about daughters-in-law. And you don't want to lay that burden on them right away. So you think you're Superman and go at it. So those personal approaches to things, I think, is important for caregivers. The other thing which I think is so important for the caregiver in terms of advocating or speaking for that beneficiary, it's important that maybe getting power of attorney is a little bit of a step with a lot of elders. They're not ready to turn over the reins of everything as much as power of attorney. But certainly you can turn around and suggest that I know that if I call Medicare and you go on, I can be a designated representative of yours with Medicare. So you don't have to call Medicare all the time. Or Social Security. I can go on and do that same thing. And once you get that out of the way in the beginning, you can more effectively address issues that particularly on the finance side, that are coming up for them. So don't be afraid, reach out and keep yourself healthy. Do the things you got to do.
Thank you, John. Juan, I'll turn it over to
Yes.
you.
I really appreciate, Natasha and John's comment. I will really like to follow up with Natasha's comment. According to the research, when I work in the previous, nonprofit cancer society, there's a really important question. If somebody never reach out to get help, most likely this person, that was a really cancer patients survey. Most likely this person and this family members will never reach out to any agency for help. So how important for all of us to work together here today. And then I want to thank everybody to take your time, join today on the weekend, Saturday. And this is a lovely presentation with all the wonderful knowledge here. So take away this reach out again, like everybody mentioned. I think we have a lot of agencies here can help all the speakers today. My agency also Open Doors Youth and Family Service is a wonderful way to really work together. Don't care your loved one alone. There's a lot of people out there can provide the support programs. My agency has a lot of all free, virtually right now with the education programs, support group. Myself doing the consultation, you'll be surprised. A lot of people will ask me like, how much do I have to pay you? So I would say, no, we're nonprofit. Consultation is all free. I'm very grateful when people really had a phone conversation with me to tell me all the stories and needed and the resources they need, because it's really hard for them to really share. This is sometimes with violence behavior. They say, how can I help my grandma or my grandfather? And it was really honor for me to be there to help them. So I hope everybody should really reach out, visit doctor regularly, at least once a year, with those kind of data can really help you to care for your loved one in a very high quality of care, have a better self-care, and then try to put the whole family together, has a better care plan for your loved one. Live in the moment, that will be my last suggestion. Really just, focus on art, music, exercise, even meditation together, learn together, enjoying that moment. So before I end, I also want to suggest to Open Doors Youth and Family Service. Today's, education is so wonderful. I really honor you guys can really do the podcast in the future, because this is really well done and professional way as a panel together. Thank you. Thank you for inviting me.
Thank you, Juan. Appreciate it. Yvonne, I'll turn it over to you. Yvonne, you're currently on mute.
Oh, I'm sorry. Thank you so much for the invitation to be a panelist. I really do appreciate it. Working with the elderly is my passion. We need more people. We need more psychotherapists. We need more physicians. We need more nurses. We need more mental health providers. We need more community providers to have that same amount of passion. We need to honor our elderly and give them the dignity and respect that they deserve. We need to make sure that we are supporting places that are taking care of an elderly person when a caregiver is not. There needs to be more respite out there, right? I'm going to tie it into the other caregiving issue as well. There needs to be more respite and more resources for caregivers as well. Nursing homes do not have to be the permanent place, but sometimes a caregiver may want their person to go there for a week just so that they can be better caregivers. A nursing home cannot keep your person, against your will. So that is an urban legend. That is a myth. That is not true. That once, your person goes to rehab, they have the right to go home. It is not a jail. Also, caregivers, there's a lot of support groups. I know pre-COVID, but now they're also meeting virtually. So I would guarantee, I'm all about the psychotherapy on the both sides. Caregivers need support groups. They need to talk to other people who are going through similar things so that they can help each other find out and get additional resources. Unfortunately, I get it partnering with family, but sometimes it's just you. So you got to go out and find you some other caregivers that you can share stories to, partner with, and get support group support for you so that you can better take care of your person. Thank you so much.
Thank you, Yvonne. And it's Evelyn, I now turn it over to you for your final thoughts.
Thank you. Good afternoon, everyone. Again, I'm just so excited about this whole thing today. I'm so excited. I just wanted to say that it is important, so important to have a good rapport with your healthcare providers, with your teams. It's good to be able to speak to them honestly, tell them the things that's on your heart. Also, by listening to everyone, I learned so much today. And I just wanted to say that just because a person is getting older does not mean that everything that's going on with them is attributed to their age. Look at the changes that are going on with them. One thing that Yvonne brought up, she brought up incontinence. And I wanted to speak to that about urinary tract infections. Sometimes you might find that your loved one is acting different. They're talking different. They seem a little confused. It might be something as simple as a urinary tract infection. Urinary tract infections cause changes in altered mental status in patients. So sometimes if you see your loved one just seem a little confused or whatever, it might be as simple as calling your doctor, schedule an appointment and ask can they come in, and it might just be a urinary tract infection. And she also brought up about the patient yelling. Sometimes people say, oh, they're old, they're just becoming combative, that's just them, they're just getting older. But it was as simple as him getting something to help him, an assisted device with hearing. So in all that, I would say, just look at the changes. You know your loved one more than anyone else. Look at their changes and please don't attribute it to age. Just maybe even go to the doctor. Thank you all. I learned so much today. It's so awesome to see everyone's zeal and their passion and their love for what they do. And that is very, very awesome. Have a good day. Thank you.
Thank you, Evelyn. I now turn it over to Natasha for the final closing remarks, and thank you to all our panelists. Natasha, you're on mute.
Sorry about that. Thanks again to everyone for joining, for just showing up and offering the knowledge and expertise that you have to supporting our elderly. I really appreciate it. I have a passion for working with the elderly as well as I do with the youth and anyone I engage, to be honest. So the information that you all shared today was enlightening for many. I'm getting messages even before we're off asking who folks are and how they can contact you all. So again, I'm going to share the information for all the organizations via email to those who registered. Thank you to the panelists, John, Yvonne, Wan Ling, Marsha as the co-host, and Evelyn. You all did a great job today in just bringing forth the message and answering the questions that many folks presented to us. So thank you sincerely, I appreciate it. And again, we're going to share now information on the organization, how to contact us if you are watching live and you would like access to the resources. Thanks, everyone. So to learn more about our program services and upcoming events, we have a website, which is opendoorsYFS.org. You can also email your inquiries to inquiries@opendoorsYFS.org. Follow us on social media, Facebook, Instagram, and YouTube.
It's beautiful, simply beautiful. Very nice.
Thank you.
Okay, thanks everyone. Enjoy the rest of your day.
Thank
Thank
you.
you.
Thanks for
Thank you
having me.
so much.
Thank you.
Okay.
So much.